I've been able to do a qualitative study where I actually interviewed women on intimate partner violence and substance misuse and pulled different themes out of their stories so that we can get a better idea of what they need and what they go through.
My field placement is with the Accountable Health Communities Project for the WVU Community and Rural Health Institute. It seeks to address health-related social needs that any Medicare, Medicaid, or CHIP beneficiaries might have while they're in the normal workflow of their patient experience, whether it's in a clinic, hospital admission, emergency department, or inpatient substance abuse.
In one of my classes, we got to focus on a subject that we were really passionate about, and I really love diving deep into women's health. So we did like a documentary that we brought together as a final project and focused in on breast care and preventative measures.
I worked at the health department as an intern during undergrad, and there have been lots of opportunities during grad school through SAF, which is the Student Association of Public Health. And this semester, I'm helping out with COVID vaccine registration.
Intro to Injury Prevention is the most interesting public health class I've had to take so far. Periodically throughout the class, you get to take certain trainings. So it's a very practical class. You do things like stop the bleed training, and during the opioid epidemic section, you learn how to inject Narcan.
I'm taking a program evaluation course this semester with Dr. Abilzo, and we're actually getting the opportunity to create an evaluation plan for a health program with a real client, a real program in the community.